You're the FI1 working on an acute medical unit. You're clerking an A patient who is presented with suspected meningitis. You check thoroughly for a rash and conclude that there is no rash present. However, you forget to write this down in the clerking notes. Later that day, the patient deteriorates and your senior house officer, SHO, notices a petechial rash. Antibiotics are initiated for septicaemia, and your team starts to organize a transfer to the intensive care unit, ICU. Choose the 3 most appropriate actions to take in this situation. A. Add a current entry explaining that no rash was present on your earlier examination. B. Add to your earlier entry that there was no rash present. C. Arrange to meet with your clinical supervisor to discuss the event. D. Ask your SHO not to mention the rash in their documentation. E. Call your medical defense organization for advice. F. Don't make any addition to the notes. G. Explain to your ream that you had checked for a rash earlier. H. Write a reflection for your e-portfolio about the situation. Answer. A. GH. First, you should talk to your team and let them know that when you examined the patient earlier, you had checked for a rash. G. Since this is an important piece of information and will reassure the team that it was not missed. It is vital that all medical records are contemporaneous, so you should not go back and alter your earlier entry in any way. B. This would be a dishonest thing to do, even though what you are adding is truthful. It is a good idea to document that you had checked for a rash and found none, which should be done in the current place in the notes with the current time, and you can write that it is a retrospective comment about your earlier examination. A. This is advisable in case questions are raised later, and it is better than not recording anything. F. The SHO should not be required to be dishonest in order to cover your back. D. And they're likely to be unimpressed by your lack of professionalism if you ask this of them. It is very unlikely that they would agree to omit this information from the notes because it would bring their own conduct into question if investigated. You haven't done anything unethical or made any major error in this scenario. You have simply forgotten to document a negative, finding that later turned out to be pertinent information. For the same reasons, you do not need to seek legal advice, E, or formal support from your supervisor, C. However, it would be beneficial for your learning and development to reflect on the experience and how you will learn from it. H, to ensure your examination documentation is thorough in the future. You are working with a senior house officer, SHO, who has recently passed the first part of the surgical membership exam. Since then, they have started introducing themselves to patients and on the phone as Mr. Wilson rather than Dr. Wilson, implying that they are a fully qualified surgeon rather than a surgical trainee. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. After the SHO sees a patient, enter the room and tell them that they have not been seen by a surgeon. B. Explain to the consultant what is happening. C. Ignore the matter. By working for a surgical firm, the SHO is giving a surgical opinion. D. Inform the Royal College of Surgeons about what is happening. You tell the SHO that it is not in their best interests to let people think that they're more qualified than they are. Answer. EBDCEA. As a doctor, you should not make it appear as if you hold higher qualifications than you do. If someone is doing this, then they need to be made aware that it is inappropriate for both their patients and colleagues to think that they are talking to someone more qualified than they are. The best action, therefore, is to explain this to the SHO, E, and also to make your consultant aware of the situation. B. Of the remaining options, talking to the relevant Royal College is the best as the rest involve either undermining the SHO in front of patients, A, or leaving the SHO to practice dangerously, C.